faithfully conveying value and interpreting great books from around the world.
Hello, this is Sally's Book Talk.
Today, the book we're interpreting for you is The Birth of Surgery. The subtitle is From the Renaissance to the Revolution in Transplant Surgery. When you think of surgeons, what comes to mind? Feel free to share your thoughts in the comments section. Your impression of surgeons. Surgery is a modern medical discipline that primarily uses surgical excision and repair as treatment methods. Compared to internal medicine, which only uses drugs to treat diseases, surgical methods are more intuitive and their effects more direct. However, wanting to cut into the human body or even open it up is not an easy task. Because of this, even though doctors have been treating people since ancient Greece and Rome over 2,000 years ago, surgical technology stagnated. True surgical medicine began to develop only 400 years ago during the Renaissance, and it has seen qualitative leaps in the last 100 years. First, doctors understood the basic structure and organ functions of the human body through extensive anatomical practice, laying a solid theoretical foundation for surgery. Then came the invention of anesthesia, disinfection, and anti-infection technologies, clearing obstacles for the successful conduct of surgical operations. Finally, the development of various human implant materials and techniques gave people more options when facing disabilities and defects. This book reviews the development history of surgical medicine over these 400 years, from the Renaissance to the 21st century, filled with the heroic feats of medical pioneers pushing boundaries. The Wall Street Journal bluntly states that this book is bold, authentic, vivid, and details the inventors, eccentrics, and lonely geniuses in the medical field. The author of this book, David Schneider, is a renowned American surgeon specializing in joint replacement surgery and a longtime contributor to journals like the New England Journal of Medicine. Next, I'll divide the history of surgical development into 3 parts for your interpretation. First, the establishment of the theoretical foundation of surgical medicine. Second, the exploration of surgical possibilities. Third, the exploration of surgical implants. Let's first look at the first part, how medical pioneers step by step established the theoretical foundation of surgical medicine. As early as the 4th century BC in ancient Greece, philosophers and scholars began exploring the principles of health and disease, thus sparking interest in the structure and function of the human body. Hippocrates, hailed as the father of Western medicine, is undoubtedly a representative figure among them. Well, Hippocrates' most significant contribution was distinguishing medicine from witchcraft and religion. He didn't believe treating diseases could rely on miracles. He thought diseases should be explained by natural causes. However, based on primitive cadaver dissections, he conceived a flawed theory to explain the body's internal workings and dysfunctions, the 4 humors theory, that influenced medical history for over 1,000 years. Hippocrates pointed out that during digestion, food transforms into bodily humors, including blood, phlegm, black bile, and yellow bile. These 4 humors must be in balance. If one is excessive or deficient, a person will fall ill. For example, if a patient has a fever or develops skin redness due to illness, it means excess blood is present, leading to bloodletting therapy. So, common practices included cutting veins or using leeches to draw blood, often resulting in patients dying from excessive blood loss. Over 500 years after Hippocrates' death, during the Roman era, another famous physician, Galen, emerged, inheriting and promoting the 4 humors theory, especially advocating bloodletting. He went further down the wrong path, but this cannot overshadow his great achievements in anatomy. Especially since human dissection was taboo in ancient Rome, Galen relied on his surgical experience as a gladiator physician and dissections of live farm animals to propose profound anatomical insights. In his masterpiece, On Anatomical Procedures, Galen first elucidated correct organ functions. For instance, by tying and untying the ureter, he proved urine flows from kidneys to bladder and severing the spinal cord causes loss of movement and sensation. He also discovered that ligating the recurrent laryngeal nerve, which controls vocal cord movement, can cause loss of voice. Most importantly, Galen overturned the ancient theory that the heart was the body's command center, proving the brain sends neural impulses through nerves to muscles to control actions. And although Galen's anatomical achievements were unparalleled at the time, they contained many errors. For example, as we'll discuss later, Galen's assertions about blood circulation were completely wrong, and these errors weren't corrected until over 1,000 years later. Right. Throughout the entire Middle Ages, due to complex social factors like wars, natural disasters, and plagues, scientific activities nearly ceased, and the foundation of rational medicine wasn't firmly established. During the long span of over 1,000 years, medicine was once again captured by religion, with divine will becoming the sole explanation for diseases. The true origin of modern medicine traces back to the Renaissance period, starting in the 15th century, which brought revolutionary changes to European society. People's demand for medical care and thirst for knowledge grew stronger. To treat humans effectively, one must first accurately understand the body's physiological structure. Thus, despite a millennium-long ban on human dissection, anatomy still developed with great difficulty. Additionally, by the mid-15th century, improvements in printing and woodcut illustrations allowed anatomy pioneers to disseminate their insights more efficiently. When speaking of human anatomy pioneers, Andreas Vesalius must be mentioned. In 1514, Vesalius was born into a medical family in Brussels, Belgium. In 1533, Vesalius entered medical school. He was taught the then-dominant Galenic medical theories, but the superficial anatomal instruction hardly satisfied Vesalius.
He decided to conduct research himself.
He visited Paris's Cemetery of the Innocents multiple times, selecting decaying corpses and maggot-infested skeletons to secretly bring home. After graduation, Vesalius became chair of surgery and anatomy at Italy's University of Padua, soon launching his first major anatomical demonstration, one of which, this 18-day dissection, earned Vesalius immense popularity. Afterward, wherever Vesalius lectured, grave robbing and corpse theft surged locally. Based on extensive dissections and research, Vesalius published several anatomical works, most notably the Humani Corporis Fabrica. Published in 1540, when Vesalius was under 26, it described instruments for each dissection step, bone cleaning techniques, and processes for muscles, joints, organs, and nerves. Vesalius cited over 200 examples in the book, revealing errors in Galen's assertions about human structure and function, first challenging classical Galenic medicine's authority. And next, a young Englishman who also rose to prominence in Padua, Italy, went even further in overturning Galen's theories. He is recognized as the world's first physiologist. William Harvey fundamentally criticized Galen's theories about human blood and deduced the correct principles of blood circulation. William Harvey was born in England in 1578 to a prosperous small farming family. From childhood, he showed intense interest in the farm animals, often spending entire days observing and studying them. In 1600, the 22-year-old Harvey came to the University of Padua in Italy to study medicine. After graduation, Harvey married the daughter of the royal physician and later succeeded his father-in-law to become the king's personal physician. This position not only brought him status and wealth, but also provided time and resources for his personal interests. Harvey built a small home laboratory housing various animals and plants. Driven by endless curiosity, he conducted dissections nearly every night. He developed an interest in the mechanism of animal hearts and blood circulation. According to Galen's theory, blood was continuously produced by the liver, and arteries had their own pulsating function that caused blood flow. Now, however, through studying eel hearts, Harvey became convinced the heart itself, not arteries, was the driving force behind blood flow. Harvey also obtained an executed criminal's body through personal connections, discovering the connection between heart and lungs. Next,
Based on human heart size, Harvey calculated the blood volume pumped per beat, then deduced the heart pumps about 500 pounds of blood hourly at normal rates.
If the liver produced blood, it would need to constantly generate enormous quantities, an unimaginable scenario.
Harvey completely abandoned Galen's theory and proposed the earth-shattering concept of blood circulation.
And in 1628, he published his classic masterpiece, De Motu Cordis. For decades after publication, Harvey faced constant attacks. Challenging traditional authority was never easy, especially since his theory brought no immediate treatment breakthroughs. Heart surgery only began over 3 centuries later. In the following 18th century, another young man devoted his life to stunning research that dealt a fatal blow to Hippocrates' humoral theory, transforming medical thinking toward disease manifestations in organs. He is Giovanni Morgani, known as the founder of pathology. What kind of discipline is pathology? If anatomy is the study of normal human structures, then pathology is the anatomical study of sick individuals. It identifies where diseases are located. In 1701, at just 20 years old, Morgani began collecting information on his patients and autopsy results, compiling case studies into a book through careful observation and sharp clinical analysis. Over the next 60 years, while treating patients, he gathered information and organized data, writing this work that would change how doctors view diseases. In 1761, The Seats and Causes of Diseases was finally published. By then, Morgani was 80 years old. The Seats and Causes of Diseases covered 700 cases. For each case, Morgani provided detailed medical histories, reconciled changes in his thinking, and cited and discussed authoritative views. Readers could search by symptoms, such as chest pain, investigate cases with similar symptoms, and find causes and possible effective treatments. Morgani summarized in the book that symptoms are the cries of diseased organs. This new understanding of diseases is concise and to the point, directing doctors' attention to specific organs. From then on, doctors had to listen carefully to the cries of diseased organs, meticulously observe and examine patients, and explain the reasons for their suffering, based on experience. Therefore, Morgani is not only the father of anatomical pathology, but also hailed as the pioneer of modern medical diagnosis. The works of Harvey and Morgani are called the Golden Triangle that shattered old medicine, marking the beginning of new medicine. Now that human organs and functions are understood, and we know to find causes through diseased organs, we can proceed to precise interventions and treatments of the lesions. Surgery is undoubtedly the most direct method. Next, medical pioneers began exploring the possibility of using surgery to treat diseases, which is the topic of our second part. And as we mentioned earlier, figures like Vesalius were surgeons, but during the Middle Ages and early Renaissance, surgeons had low status. Their so-called surgical procedures were mainly bloodletting and amputations, along with basic trauma treatments, like using boiling oil or cauterizing wounds to stop bleeding. Moreover, doctors didn't wash hands before surgery. There was no disinfection, anesthesia, or antibiotics. For many patients, surgery was no different than a death sentence. Those undergoing operations either died in agony during the procedure or succumbed to infections. No wonder David Wotton, author of Bad Medicine, openly asserted that before 1865, no matter what illness patients suffered, the best choice was to endure alone, away from doctors' care. This situation only gradually improved by the mid-19th century. First came anesthetics, finally freeing surgeons from enduring patients' screams and struggles during operations. Actually, humans had long been aware of using anesthetic substances. As early as 1680, English physician Thomas Signum introduced laudanum, a mixture of sherry wine and opium. For centuries afterward, laudanum was mainstream medicine's primary painkiller, but being ingested, its effects were unreliable due to absorption and metabolism. So besides administering laudanum beforehand, doctors needed to strap patients to operating tables or knock them unconscious. To prevent patients waking mid-surgery, outstanding doctors required one essential skill: speed. In the early 19th century, chemistry's rise brought ether, an American-made substance that became light in the darkness. In 1846, dentist William Morton, hearing of ether's anesthetic properties, experimented on himself by pressing an ether-soaked handkerchief to his nose. Had it not fallen off, he might have died. After awakening, Morton marveled at ether's effects, but also discovered controlling inhalation dosage was key. Soon, Morton conducted history's first public painless surgery using his newly invented ether inhaler at Massachusetts General Hospital's surgical amphitheater. The 25-minute procedure ended with the patient waking, saying he only felt a slight scratch before losing consciousness. However, with candles and gas lamps everywhere, ether's flammability became its critical flaw. In November 1847, Scottish obstetrician Jane Simpson discovered another anesthetic, chloroform. To evaluate chloroform's anesthetic effect, Simpson and a group of his relatives and friends poured chloroform liquid into glasses and inhaled it. Instantly, everyone became very cheerful and excited. But suddenly, everyone completely lost consciousness, collapsing to the ground, and then waking up all twisted and lying on the floor. After exploration, Simpson applied chloroform to obstetric practice, and eventually, chloroform became the preferred surgical anesthetic in Europe for decades to come. It's said that Queen Victoria also used anesthesia during several childbirths between 1853 and 1857. By the 1860s, chloroform and ether were widely used in Europe and America, primarily altering the neural pathways in the brain and spinal cord that control excitation and inhibition. Today, new anesthetic agents like deflurane, sevoflurane, and isoflurane act faster with fewer side effects. Once pivotal ether and chloroform had become history, but for the first time they made humanity realize that we can control our consciousness, overcome pain with anesthesia, and create a new world without pain. However, before the advent of antiseptic surgery, anesthesia didn't improve outcomes much. To achieve true surgical efficacy, humanity had to uncover the secret of a microscopic world. First, a Hungarian obstetrician discovered the existence of germs, thus advocating for doctors to wash hands and disinfect before surgery. In 1831, Ignaz Semmelweis, a young obstetrician at Vienna General Hospital, discovered a horrifying fact. Women delivered by doctors were much more likely to die from puerperal fever than those delivered by midwives. Puerperal fever is a sudden postpartum illness where women initially experience pain and swelling in the birth canal, then discharge foul-smelling pus, followed by persistent high fever and shock, leading to death. Semmelweis began researching why doctors delivering babies strangely caused more maternal deaths. Apart from sleeping, he spent almost all his time in libraries, autopsy rooms, and wards seeking answers. Until tragic news came. One of Semmelweis's colleagues and friends cut his finger during an autopsy and eventually died from a massive infection. Grieving, Semmelweis personally dissected his friend's body and found the entire abdominal cavity and organs filled with pus, exactly like the bodies of those who died from puerperal fever. Semmelweis immediately realized that puerperal fever and the disease that killed his friend were actually the same illness. If his friend's illness was caused by exposure to cadaver particles through a wound, then the source of puerperal fever must be identical. In an era when doctors didn't wash hands or wear rubber gloves, Semmelweis realized their routine morning autopsies were transferring cadaver particles to their obstetric patients. 19th century Westerners already used chloride solutions to eliminate decay odors in homes and workplaces. Semmelweis theorized colloid could destroy decay particles, and soon a basin of diluted chlorine disinfectant appeared at the ward entrance, requiring all medical staff to wash hands before entering. Within months, puerperal fever mortality plummeted, but Semmelweis's findings weren't accepted because he exposed doctors' negligent killing, damaging their professional dignity. He was branded a traitor to medicine. This cost him his reputation and job, reducing him to a deranged extremist. His family confined him in a mental asylum, where he soon died tragically. Doctors performing his autopsy found he died from septic infection with massive chest pus, identical to the disease he'd solved. Most scholars believe Semmelweis contracted infection from violent trauma during confinement, common for 19th century asylum patients. Semmelweis's life ended tragically and ironically, but this tragic pioneer first discovered the microscopic germ world and demonstrated disinfection's value to humanity. On August 12, 1865, the day before Semmelweis died in the asylum, British surgeon Joseph Lister was conducting a clinical trial. Though the experiment was simple, its significance was profoundly far-reaching. An 11-year-old boy hit by a carriage suffered a compound tibia fracture where bone pierced skin. High infection risk, usually requiring amputation to survive. In 1865, almost no one believed wound festering came from germs, but Lister was testing this possibility through clinical experiment. Lister didn't amputate the boy's leg. Instead, he cleaned the wound with carbolic acid, applied gauze soaked in it, covered it with tin foil to reduce evaporation, finally secured it with splints. Carbolic acid's scientific name is phenol. During London's Great Stink of 1858, people discovered phenol eliminated putrid odors. Lister theorized this substance could combat invisible particles causing wound infections. As days passed, the boy's wound showed no inflammation or pus. Instead, it gradually healed. The bone fused naturally, saving the boy's leg. The experiment succeeded! From then on, Lister used carbolic acid to disinfect every surgery, ushering in the antiseptic era. The Franco-Prussian War, 1870 to 1871, provided a unique testing ground for Lister's disinfection technique. Prussian army medics used carbolic acid, drastically reducing infection deaths, while French stuck to unscientific ointments. Amputated soldiers had 70% mortality from infections. Thereafter, the world adopted Lister's antiseptic method. Where Semmelweis failed, Lister succeeded. As Francis Darwin said, in science, credit goes to the persuader, not the first thinker of an idea. By late 19th century, microscopes revealed microscopic organisms. Soon, suggestions emerged. These microbes might cause not just infections, but other major diseases too. Among Prussian army doctors was Robert Koch, later called the father of bacteriology. Post-war, Koch became a rural doctor, where anthrax outbreaks occurred. He built a makeshift home lab, researching pathogens alone with a basic microscope. Using his daughter's pet rabbit, he identified anthrax-causing bacteria. Next, using cattle eyeballs from slaughterhouses, he cultured anthrax bacillus and decoded its life cycle. At 38, Koch reached his peak, identifying tuberculosis's cause and culturing Mycobacterium tuberculosis. Before the 19th century, tuberculosis was humanity's deadliest killer, claiming 1/7 of all humans during that century alone. And then, Koch also invented a golden rule for studying bacteria. First, isolate bacteria from infected animals, culture them externally, then infect another animal until observing identical organisms under the microscope. This became known as Koch's postulates, opening a new era in pathogen research. In 1905, Koch received the Nobel Prize for tuberculosis research. Before antibiotics, TB cases were already declining, a monumental human victory. When surgeons meticulously operated in sterile environments under anesthesia, patients found medical care truly valuable for the first time. In subsequent decades, improved sanitation dramatically reduced epidemic outbreaks. Yet acute or chronic infections like syphilis, ravaging Europe for 400 years, remained untreatable until antimicrobials emerged. The first recorded antimicrobial, salvarsan, debuted in 1907 after German scientist Paul Ehrlich tested dozens of formulas. In animal trials, salvarsan showed efficacy against syphilis and other diseases. Unfortunately, its narrow therapeutic range and severe side effects limited use. In 1932, Bayer scientists tested thousands of compounds to develop another synthetic antimicrobial. Prontosil, a sulfa drug, dramatically reduced puerperal fever mortality from 20 to 30% to 4.7% virtually overnight. Young Franklin D. Roosevelt's severe streptococcal pharyngitis at Harvard was cured by newly launched Prontosil. Next came antibiotics, micro-produced inhibitors, starting with the famous penicillin. Scottish doctor Alexander Fleming accidentally discovered that penicillium mold produces an antibacterial substance, penicillin. Over a decade later, scientists Howard Florey and Ernst Chain overcame wartime challenges to achieve mass production of penicillin. On December 10, 1945, Fleming, Chain, and Florey received the Nobel Prize in Physiology or Medicine for penicillin's discovery and development. Afterward, antibiotics like tetracycline, streptomycin, chloramphenicol, and erythromycin were rapidly isolated from soil samples. By the 1950s, antimicrobials dramatically reduced infant mortality and doubled average life expectancy. Antimicrobials not only eliminated infection fears, but opened minds to safely implanting foreign materials in the body.
Early surgery mainly involves subtraction, amputations, or removing appendices.
But what if vital organs were diseased? Could surgery add implants to replace failing organs like hearts or joints? Now we explore Part 3, Pioneers' Exploration of Surgical Implants. First, let's discuss the evolution of implant materials. Actually, implant attempts began earlier to address tuberculosis-induced bone issues. As mentioned, Robert Koch identified Mycobacterium tuberculosis in 1882.
When TB infected bones and joints, bodies slowly deformed with increasing pain.
But streptomycin, the TB drug, wasn't discovered until the 1950s.
So for half a century, surgeons made bold interventions on late-stage TB patients.
German surgeon Themistocles Gluck began orthopedic treatments for bone TB patients in 1882. He discovered through experiments that stitching together torn skin edges would heal them. Gluck reasoned this principle should apply to broken bones too. Fix and connect them, and they'd heal. But what material to use? Gluck chose ivory because it most resembled bone at that time. Plus, ivory was abundant in Germany's colonies then. Starting in 1890, Gluck implanted processed ivory fragments into patients' diseased joints to aid recovery. In 1893, French surgeon Jules Pion first implanted a platinum and rubber shoulder joint in a patient. Initially successful breakthrough tone, patient's pain vanished and mobility returned. But pre-antibiotics, this innovation was too advanced and infections forced implant removals. Gluck and Pion faced ridicule and abuse from medical peers. Late in life, Gluck reflected, "In medicine, known facts take time to reveal true value." In 1923, American Dr. Smith Peterson invented a glass mold for hip joints to guide tissue regrowth. Glass is inert, non-reactive with human tissue, but its fragility was a major drawback. Implants required toughness and wear resistance. In 1938, American surgeon Charles Venable discovered the ideal material, cobalt chromium molybdenum alloy. This alloy contains 65% cobalt, 30% chromium, 5% molybdenum, plus trace manganese and silicon. With antibiotics and sterilization advances, cobalt chromium alloy revolutionized joint implants. Post-War II plastics entered surgeons' view through chemistry and polymer science. American surgeon John Charley pioneered polytetrafluoroethylene Teflon for hip replacement implants. Years later, he discovered Teflon implants were severely eroding, creating wear debris around patients' hip joints. Seemingly inert materials might be completely unsuitable for the human body. To confirm his suspicion, Charnley conducted a crazy experiment. He ground Teflon into powder samples and injected them into his own thigh with a large needle. 9 months later, distinct nodules formed under his thigh skin. He excised and examined the Teflon modules surrounded by fibrous tissue masses. From then on, he knew he'd never use Teflon again. Devastated by failure, Charmley sank into guilt and depression until a new candidate material redirected him.
This was high molecular weight polyethylene still used today. Charmley tested its wear against Teflon on machinery.
Results showed 3 weeks of polyethylene wear was less than Teflon's damage in 24 hours. Charlie repeated his experiment, injecting polyethylene into his thigh.
After 6 months, no nodules formed.
On December 28, 1963, Charnley published his findings in The Lancet, warning doctors about Teflon issues. Soon, Charnley performed hip replacements with polyethylene implants, replacing failed Teflon prosthetics, free of charge. Today in the U.S., Charnley's polyethylene material is implanted millions of times annually. We've glimpsed a fragment of implant surgery history. Implants are now ubiquitous, from bones and muscles to GI tracts, urogenital systems, ENT, oral cavities, even hearts and brains. They range from metal-plastic drug combos to biological implants like corneas, kidneys, hearts, especially with electronic components turning sci-fi into reality. They're widely used in our two most critical organs, the heart and brain. For centuries, scientists have been fascinated by the body's bioelectrical properties. The heart best demonstrates bioelectricity. Its sinoatrial node acts as a natural pacemaker, signaling the atrioventricular node to rhythmically stimulate cardiac muscle. But if this pacemaker fails, life hangs by a thread. Facing failing hearts, doctors realized implants could assist. In 1957, American surgeon Walton Lilhigh implanted the world's first wearable pacemaker in a child. This device had just been invented by his colleague.
Animal testing on dogs was completed just the day before.
Defending criticism, Lilhigh stated, lab results showed it worked. I couldn't waste another minute, he said. I couldn't. Let a child die without using the best technology. In 1957, U.S. surgeons could implant devices without FDA approval. So Lilhigh's actions weren't illegal. Then came the final frontier, the brain. Before 1982, brain implants were sci-fi fantasy. Surgeon Alem Benabid first stimulated Parkinson's patients' thalamic nuclei with microelectrodes, outperforming drugs. Building on this, Benabid permanently implanted electrodes connected to external devices in 1987. This became the world's first true deep brain stimulation device. At 100 Hz stimulation, a patient's hand tremor stopped. Previously rigid, he could now drink unaided. He and his family wept, holding a cup for the first time. One of surgery's most glorious moments. The book concludes with future visions.
AI and nanotechnology will enable genetic-level repairs.
Perhaps humans will grow organs from their own cells, eliminating disease's terror, all made possible by medical pioneers' relentless efforts throughout history. Feel free to share your reflections on this medical history journey in the comments. Well, that's the birth of surgery. This concludes our interpretation of the book for you. Reading notes are below the audio. We'll see you next time.